Petre, Assistant Professor of Medicine at Mount Sinai Hospital, and she joins us from New York. So, Doctor, thank you very much for your time. Experts are obviously concerned about these new numbers. Give us a sense, though, of exactly what you are seeing on the ground. Is the health system in the country able to cope with these numbers?
Benita, we definitely are entering the third spike of this pandemic, and this could be worse than what we had in the spring in July. All the key metrics are pointing in the wrong direction. We see surges everywhere, including rural areas. 10 states have seen the highest numbers so far, and on Friday we had 70,000 new cases. For instance, in Wisconsin, 90% of hospital capacity has been reached, and they are opening field hospitals. If we continue at this pace, it will make spring look like a picnic.
Well, that really is disturbing to think about. Yet, despite these numbers that we're hearing and you're describing for us, Dr. Anthony Fauci is saying that things would have to get, in his words, really bad for him to advocate for a national lockdown. Is he right? What do you see as the best solution right now, given what you've just described to us?
Benita, what he means is that we have to prioritize the basic health measures. It's because today we have more tools in the toolbox, and no one wants to go back to a lockdown. We have more understanding how to treat this virus. We have more testing. We do have more contact tracing. And we definitely know we have scientific evidence that public health measures do work. Masks do work. Social distancing does work.
And of course, when Donald Trump says that he's never felt better after he had the coronavirus, saying he thinks he's immune, as a medical expert, Doctor, what do you make of his message to the US people and the fact that he still doesn't wear a mask in public?
His statements definitely make the healthcare experts scratch their heads because they contradict what medical opinion are and what advice is across the board. He did receive VIP treatment, and obviously he's feeling well, but this message can be dangerous for the community. What Dr. Fauci and everyone is saying, and we have proven scientific evidence, immunity doesn't last and masks do work. We actually have cases of reinfections as soon as within 2 months, and we have one case of death from reinfection.
Well, these mixed messages certainly aren't helping the world over. Thank you so much, Dr. Luiza Petre, Assistant Professor of Medicine at Mount Sinai Hospital in New York. We appreciate your time. Thank you.
Thank you.
Now, the numbers